I'm Dr. Jolly Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here I would like to share my professional experience with this approach. This series is about my experience with patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medication. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continuing with the lifelong medication. Here we learn of the approach for a patient who was suffering from diabetes for the last 21 years, hypertension for the last 3 years, hypothyroidism for 3 years, cardiovascular disease for the 10 months, and his TMT was positive. Angiogram showed a triple vessel disease, and he was advised to undergo bypass surgery. His main symptoms were tiredness and dyspnea, that is when he during physical activity he feel breathless. He was taking 9 tablets a day. In spite of all these medications, was advised to undergo bypass surgery. Here I will try to explain how the surgery could be avoided, how long it took for multiple medicines to be reduced and stopped, how long it took to get relief from symptoms, and progress evaluation based on corresponding improvements in periodic tests. When we come to the patient detail, this is a 63-year-old man. His height is 175 centimeter. Weight is 76.9, that is almost 77 kg, and his body age is 66, and his abdominal circumference is 96. He is having abdominal obesity, and his fat percentage is 31.9, that is visceral fat is high. When we come to the diagnosis, he is suffering from diabetes for the last 21 years, hypertension and hypothyroidism for the last 3 years, and on medication. And the current major problem is he is suffering from cardiovascular disease and advised to undergo a bypass surgery. When the TMT and angiogram showed 3 vessel disease. And when we consider the disease category, he is having metabolic syndrome and autoimmune disease, that is Hashimoto's thyroiditis and metabolic syndrome, which include obesity, hypertension, heart disease, and everything comes under metabolic syndrome. When we come into the symptoms, his main symptom is tiredness, and while walking he become dyspneic. When we come to the medications, he is taking 9 tablets actually. That is for the diabetes, he is really taking 2 tablets, so this Gluxit morning and evening. And there are medications for heart disease, telmisartan is taking, Promolot, that is metoprolol succinate, and that is both is for hypertension, and Isodil, that is 3 times he is taking for the heart disease, and Roside and rosuvastatin, and also aspirin, and thyroxine 75 milligram also he is taking. And when we come to the blood reports, even though he is taking diabetic medicines, his HbA1c is 8.7, insulin level is very high, sugar is also, even though insulin should be around 20, maximum 25, but the insulin level here is 41, and the RBS level is 280, that is blood sugar level is very high. Next, his dyslipidemia is there, but he is on statin, and that is under control. And his renal function, he is on CKD. Almost all the diabetic and hypertensive patient will be having renal function reduced. He is in stage 2 renal failure, stage 3 renal failure actually. GFR is 53 only, creatinine is increased 1.41, urea is increased, and also potassium is also increased. That means he is really in trouble with your kidney function also. And his inflammatory markers like WBC count, ESR and HSCRP is high. And in spite of taking diabetic hypothyroidism medicine, levothyroxine, his TSH is high and T3 is low, and vitamin D is low. It is only 14.9. And this his troponin level, that is when there is no active muscle damage to the heart, that is troponin level shows the active muscle damage, whether there is ischemic changes or ischemic damage to the ongoing ischemic damage to the heart muscles, but troponin is normal. When we come to the scan report, echocardiogram shows the left ventricular hypertrophy. That is normally with almost all the hypertensive patients will be having a hypertrophy of the left ventricle. That is one of the reasons for this heart attack and angina also. And coronary angiogram shows a triple vessel disease, 3 vessels. There are 2 major vessels and one is dividing into 2, anterior and posterior left coronary artery. There are 2 coronary arteries, left and right. Left is dividing into anterior and posterior. These 3 major vessels also is got a block is there. That is why he is advised to undergo a bypass surgery. And it is not the position. It is not. He is not fit for putting stent also. Before starting what are the changes he had with the clinically supported lifestyle correction? What we should know, what is clinically supported, what is done in clinically supported lifestyle correction. Basically, in clinically supported lifestyle correction, what we are trying to give is to give optimal nutrition for the patient or for the body. That is, there is 57 nutrients, including water and oxygen we need. This 14 vitamins, 14 minerals, and almost 20 amino acids and 4 fatty acids and dietary fiber. So we are ensuring that all this nutrition is in the correct proportion, and also the body is getting all the stimulation for all the body parts. The only body part we can voluntarily do is our skeletal muscle, that is our muscles attached to the bones. So that is what we are going to trying to do with this physical exercise and all. So in a special pattern of exercise, we are trying to stimulate all the muscles and bones, and that will indirectly stimulate all the organs, increase the circulation to all body parts, and which will help to the nutrients to reach all the body parts. That is, only when the stimulated body part, the oxygen blood flow will increase, and so that the nutrition will reach there, and also the waste removal also will be possible only with the increased blood flow. So what we are trying to do is to give optimal nutrition, optimal activity, and also to reduce the toxin entering the body. To see that there is avoid this color, preservatives, tastemakers and all in the food. And this patient is already, obesity is there, so there is excess fat in the body. So reducing the calorie also, trying to reduce the calorie to around 650 calories per day, but ensuring all the nutrition, including all the 57, at least 55 nutrients, or everything. So if you are doing exercise only, you can absorb more oxygen. So all the 57 nutrients in the correct proportion, and minimizing toxins entering the body, and trying to promote the excretion of the toxins what is inside also. Next, we can look into what are the symptomatic relief patients has got. His main symptom was actually tiredness and difficulty in doing even day-to-day activities. He find it difficult to walk for a short distance itself. Actually, by the 8th day itself, tiredness is reduced to 50%, and by 15th day it is 70%, and 30th day he is saying that he is okay, he is comfortable. And discomfort on walking is also reduced to 60% by the 8th day and 70% by 15th day, and he is almost symptom free by the 30th day. When we come to the medications, the diabetic medicine is stopped on the first day itself. That is, if the patient is type 2 diabetes, that means the pancreas is producing enough insulin. That means the patient is the type 2 diabetes. If the patient is not producing enough insulin, then it is type 1 diabetes. Then we have to deal in a different way. But most of the 90% of the patients are type 2 diabetes. Almost all the 95% of the people who end up with this cardiac problem and all is type 2 diabetes only. So for the first day itself, diabetic medicine is stopped, and BP medication, actually by the 8th day, one tablet telmisartan is stopped. 8th day when he came, and by 15th day the primalotin, that is another BP medicine, that is also stopped. Even the isodil, that is for the cardiac, this angina pain and all. That is just taking 3 times. It is reduced to 2 times by 15th day and 1 time in the 30th day, and by 60th day it is stopped. Next is rosuvastatin, that is for the dyslipidemia and cholesterol and this thing. And it is actually, it is a single tablet, Rosidase A, that is actually containing rosuvastatin 10 mg and aspirin 75. It is split into for the 8th day itself. The tablet is a combination tablet, instead of it is taken separately. Rosuvastatin was reduced to 5 mg and ecosprin the same dose. And by 8th day, it was rosuvastatin 5 mg itself is made alternate days, and 30th day is taken twice a day, and after that it is stopped. But his cholesterol value was maintaining normal. And we are reducing the medicine only according to the blood reports, not to blind reduction. Blind reduction is only for this, abrupt reduction is only for the type 2 diabetic medicines. All the other are according to the BP medicines is reduced. The BP is monitored at home itself, and telemedicine follow-up is there. So when the BP is reduced, they will be sending the chart and all, and according to, we will give guidance for the reducing the BP. If when a patient taking BP medicine, when the patient is on clinically supported lifestyle correction, if the BP is going down, if you don't reduce the BP medicine, the patient may get giddiness and all. So that is the problem. If a normal person can take all these BP medicines, they may feel tired and giddiness can occur. So that should be very careful. And if check the BP, and if it's coming down, reduce the dose. One tablet half, then after one, we usually reduce the medicine according to the patient's particulars and the side effects also. Always prefer to reduce the more complicated medicines early, and then more safer medicines last. Then the thyroid, that is an autoimmune disease. We cannot reduce the thyroid medicine fast actually. He was taking 75 mg, and by 15th day it was reduced to 50 mg, then 25 mg, and by 60 days it was 25 mg alternate, and by 90 days it was stopped. We are making sure with each reduction, we are making sure the thyroid function is maintaining normal. Next, when we should check into what is the blood report improvements also. Actually, with the medication, his hemoglobin HbA1c, that is the 3 months average level, is 8.7. In clinically supported lifestyle correction, we check not in once in 3 months for the HbA1c, we check every week. If the patient is following correctly, the HbA1c will come down to, will start reducing within within a week itself. Actually, for this patient, his HbA1c on 8.7 to, with the medicine to, after stopping, it has come down to 8.6 in the next week itself, and 8.3 by 15th day, and 7.9 in 30 days, and 7 in 60 days, and by 90 it has come down to 6.6. That all depends on the patient also. If they are very strict, those patients who are strictly following a low carb diet, it must have been much more faster. By the time it was, by 90 days itself, it may come below 6. But this is an old man, senior citizens is 62 or something like that, above 60. So there also that also matters. If the young person, the turnover of the RBCs also will be faster. Because if the HbA1c get corrected, that means the damaged blood RBCs, the red blood cells, has to be replaced with the newer healthy cells. So it depends on two factors, how fast the HbA1c is corrected. One is the patient should be taking all the nutrients in the correct proportion, and second thing, they should the age of the patient also. So their ability to this bone marrow to replace the newer, make the newer cells also. So anyway, it was 8.7 with the medicine, and by 3 months it is 6.6 itself is a very good result. And RBS, that is actually that blood sugar level will be corrected within, if the patient is following correctly, within 24 hours blood sugar level will be corrected. And the 8th day when we come, it is only 92, and it is blood sugar. That is not the fasting blood sugar, it's only a random blood sugar we are checking, that itself is 92. But we are checking at through the home blood sugar monitoring also is there. It is also correctly maintaining actually. And even that when the dyslipidemia, when we come to, is cholesterol and was all under control with the medication, but with the, when we tapered off the medicine also, it was we were able to maintain it normally. And when even with the medicine, HDL level was low, but by day 90 his HDL level also became normal. That is the importance. Without medicine, his HDL level is came to normal. And we in clinically supported lifestyle correction, we don't give much importance for the total cholesterol, because that is needed by the body. But the body is making it, and we need it for sex hormone production, vitamin D production, and all. It is needed. So we don't restrict the we don't want to try to bring the cholesterol level to 150 and all. That is the traditional cardiology advice. We want to make it around 200. That is sufficient for us, but make sure that the triglyceride level and the HDL level is normal. Next, he was suffering from chronic renal failure also. His GFR was 53 actually, and it was increased to 64 in the 8th day, 67 in 15th day, and 72 in 30 days, and 76 by 60 and 81 by 90th day. So it is not actually, if the patient, if we want to bring it up above 90, that is ideal. Anyway, it was in the stage 3 to it brought up to stage 2. That means it is in the safe level. It is it's already 60 plus, and if he maintains his health, he will not go for a renal failure at all. And all the renal parameters, not only GFR, creatinine, blood urea, so potassium level, it was initially high. It is the 8th day onwards, potassium is maintaining normal. All the renal parameters came to normal, and the blood reports also, the inflammatory markers, WBC, and especially for this cardiac patients, we give specific importance for the HSCRP. By the 8th day itself, HSCRP is come to normal. So that is why we are confidently we can reduce this blood thinness also. Only when the troponin level and the HSCRP is normal, only we can stop the taper of the blood thinness. That is, his troponin was initially itself is okay, and by 8th day, HSCRP is normal. Even the blood cholesterol and all is under control, so we can safely taper off the blood thinners also for this patient. And when we come to the thyroid, his thyroid patient also, thyroid functions, his thyroid function was abnormal, TSH was high in the initially, but without any increase in the dosage of levothyroxine, it came down to, by 8th day, it came down to normal, and we gradually tapered off the medicines, or by the 90th day, throughout it was maintaining normal. And vitamin D level was low, and it is come to corrected to a normal level. So almost all the blood parameters came to by 90 days, everything is keeping normal. Next, when we come to the body, what is the changes happened in the body? Actually, in clinically supported lifestyle correction, what we are trying to do is correcting the body parameters at a gross level, that is at the appearance level itself, and the body weight and all, and also at a micro level, that is at a cellular level. So in this patient, macro level correction, he's a 63-year-old man, his body age was 66, that is 3 years accelerated aging is there, and his height is 175 centimeters. His weight was 77.2, it was reduced to 74.7 in 8th day, and by 30 days it was 71, and 60 days 68, and then at 90 days it is 65.8 kg. And the BMI also has a corresponding decrease, and as 25 it was initially, and it is 21.5 by the 90th day. And BP, he was on multiple medication for the BP, but with the medicine his BP was 130/80, but without medicine on the 8th day itself 122/79, and it was maintaining normal throughout, and gradually BP medicine was reducing. Actually, it's the home monitoring chart was showing much below, much more lower. Even it was going 160 and all, and he was complaining if my BP is going low. So when the BP is going low, we start reducing the medicine is very important when the BP in the clinically supported lifestyle correction. And even many patients will be on a very low sodium diet. That many will be having a low sodium level also. In that patients, we ask them to increase the sodium intake also. We give specially formulated salt also for this. The correction of sodium potassium ratio is very important. For as a nutrition supplement also, we are giving specially formulated salt also to make sure that the body sodium potassium balance is normal. And when we come to the abdominal obesity, his abdominal circumference was 98 in the beginning, and it came down to 95 by 30 days and 91 by 60 and 82 centimeters in 90 days. Then when the body age was 66 was, his body age was 66, and it was come down to 57 by 30 days and 53 by 60 and 49 by 90 days. Actually it was 3 years accelerated aging was there, and it was come to, he's now a 63-year-old man has come down to 49 years. Body age, I'm talking about the body age. And fat percentage, it was starting it was 60 to 32% and it has come down to 22% by 90 days. Actually it is ideal for him is below 20, and that is what we are trying to achieve actually. So what is by 180 days what is expecting from him is to come down to again because he, to 60 kg, and BMI, low normal BMI is the ideal because excess is all fat. Actually we want to reduce the fat and correct the lean mass fat mass ratio actually, and the BP to maintain. And the abdominal circumference now is reached 82 and would like to bring down to 75. And body age, if you do all these things correctly, body age will also come down to around 45 or so, and fat percentage at least below 20, preferably around 50. And what we are aiming is to reduce the fat and build up the bone and muscle mass and all the lean mass actually. Even the organs, heart, kidney, liver, everything will be increasing or at least becoming more healthier because of the diabetes and hypertension, all the organs are damaged. So we are trying to repair it. Next, when we summarize the benefits actually, what is the patient's benefit over the conventional treatment like going for bypass surgery and the medication and the clinically supported lifestyle correction is basically he is symptom free. He has gone for all this checkup and everything is for the his discomforts actually. So that is over by 15 days. It is the symptoms is symptom free. Then medication, he was taking 9 medicines, and now by 60 days itself, no medicine other than this levothyroxine, and everything is over by 90 days. And even if he was advised to do a bypass surgery, but even if he do a bypass surgery, he has to continue all these medicines and maybe more medication. Especially he has to undergo bypass surgery is a major surgery. So you are actually cutting open your thorax. That is the upper chest, you are making a incision. Actually we are saying the skin incision only. Actually there is a strong bone called sternum here, and it is cut open just like it's a mechanical machine using. This bone is very strong, no? Especially the sternum is a very strong bone. It is cut using electrical mechanized instrument and all, and opening the heart and even the opening the cardiac layer, and then we are visualizing the blood vessels. Actually this heart coronary arteries are passing over the heart, it is passing, and seeing the heart vessels, and then you are taking an artery from the leg or taking veins from the leg, and it is connected to the aorta and connecting it to the where the vessel blockage is there, and that is why how we are bypassing the block. For a diabetic patient, the problem is there may be micro blood vessels also affected. So it may not be that bypass surgery also may not be that beneficial for a diabetic patient actually. So you are compromising the leg blood circulation because diabetic patients are prone for a leg ulcers and all. So because the you are taking vein from there and all, there is the chance for, if the blood vessel circulation is compromised, chance for future ulcers and all is high. So even you do the bypass surgery, the problems with this diabetes, you are not going to cure the diabetes or hypertension or any of the problems. Only you are adding problem because you are cutting open and the major wound is there. There can be problems with wound healing, especially the bone. You cannot stitch you can stitch only the skin. You cannot stitch the bone. So when you are actually tying the bone with a steel wire, so the body can react with the steel wire and the healing can be affected. Especially in a diabetic patient, the healing can be affected. And also sometimes one of the internal thoracic artery, actually in the mammary artery, actually one of the arteries which is supplying, two arteries are there which is supplying the chest wall itself. Many of the cases, these arteries are taken from there and it is given to the heart also. So it is bypassed to the heart, and the denying, you see, you cannot, some compromise is there. So you are compromising the chest wall circulation and giving it to the heart. So when you are having a major operation on the chest wall, the healing can be affected because of that itself. So that is why the many bypass surgeries, there can be problems, the healing and all comes because of these multiple factors. The patient is already in a compromised immunity because of these multiple diseases, and you are doing a major operation there. And also there is chances of this heart-lung machine is connected, and your even the whole circulation is connected to another machine, and there can be micro infarcts can occur, and it can create minor strokes, major strokes, and so many complications which can come with the bypass surgery also, even if it is a reasonably successful operation also. So all these things this patient can overcome. And say, even after surgery, you will be continuing as a patient, but with the with the lifestyle correction, you can become a normal person without a disease actually. If the patient is able to follow the thing, within 3 months, another 3 months, the HbA1c will be coming down to around, we are actually aiming to bring down the HbA1c also to 5.5 by 180 days. The result will be totally dependent on the patient also. Because we know, because of many people, if the patient is failing, only they are not able to do the instructions, that is the lifestyle correction properly, take the nutrition and avoid especially calories, especially carbohydrate, and do the exercise. That is it. If you are successfully doing, the result will be there definitely. If result is there, we should ask ourselves, why I am not getting the result. That is the thing. Here, in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of the surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying fault in lifestyle, that is the cause of the disease. Next is corrective measures to rectify the damage and overcome both the disease and the need for continued medications and surgical interventions. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a partner of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects, with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed Diploma and MD in Obstetrics and Gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center, Thevara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, their treatments with emphasis to the benefits of lifestyle correction from website and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments along with the benefits and side effects, practical aspect of lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. I would like to bring to your attention how the major part of the medication we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle disease and come out of medications to protect our children, grandchildren and the coming generations from the ill effects of toxic pharmaceutical pollution. We should come out of the dependence on medication. The current norm of chronic patient on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. Better informed patients take better decisions and live longer, healthier, happier lives. Thank you.